Hello, my name is Dr. Jose Luis Ruiz, and I'm the director of Los Angeles Institute of Clinical Dentistry. And today I have a technique that I think is very, very valuable because we anesthetize our patients every single day. We know that when we anesthetize our patients and the maxilla is very predictable, it's fast, it's usually very pain-free, and we can start working in a couple of minutes, especially if you use articaine. On the other hand, when we have to anesthetize the mandible, then it becomes more complicated, it's more painful. Blocking, which is what we usually, the techniques that is used most commonly. When we block, we know it's going to hurt. We know it's going to take sometimes 10-15 minutes for the anesthesia to actually take hold. Sometimes we need to reblock if it didn't work the first time. That becomes complicated. So when do we anesthetize our patient? Every time that we do a direct restoration, we have no choice. When we do implants, when we do a periodontal procedure, when we do an indirect restoration, we have to anesthetize if we're going to prep the tooth and place cords. But during the cementation, sometimes we have the option of anesthetizing or not anesthetizing. If our technique is difficult, painful, we tend to avoid anesthetizing the patient to cement the crown. And of course, the consequences are usually that the tooth is not clean as well as it could have been clean. If there's a little bit of gum on the margin, we are afraid of placing a cord because it might hurt the patient. So really having a simple technique to anesthetize the patient in the mandible gives us a big edge. It allows us to work faster and less painful for our patients. So what are the benefits of the subperiosteal anesthesia technique? Well, first of all, it is a lot easier. It is not as technique sensitive as we know blocking is. It is faster compared to a block. You know, if you use the subperiosteal technique properly, when I use it, I can start prepping the teeth in 2 minutes. Very, very quick, very safe. You know, it's basically like an infiltration. It has very, very minimum amount of after or post-operatory pain. And of course we can do it almost painlessly as well. So it has a lot of advantages. Shortly we will share the technique, the step-by-step technique. But before I go there, I would like to mention that the correct choice of anesthesia would be articaine 1 to 200,000. What is the benefit of 1 to 200,000? That it has less epinephrine. Certainly, you know, the most popular is the articaine 1 to 100,000, similar to lidocaine. But as we all know, when we use 100,000, patients often tend to feel the tachycardia. They feel their hearts are racing, and when we use the 200,000, that doesn't happen. So I encourage you to consider using articaine 1 to 200,000. It works just as good. Now, the step by step. Let me mention it to you, and then we will see the video. The first step is to anesthetize the patient below the mucogingival line. And we want to do a very gentle infiltration on the soft tissue, on the mucosa. Usually it takes about 30 seconds to deposit a third of the carpule. And then after that happens, articaine is so fast acting that it will allow us to actually go subperiosteal right away. I tend to go straight into the papilla and until I hit the bone, and then I will start pressing so I can see a little bit of blanching. You want to see blanching. When you see the blanching, do you know that you're doing this technique correctly? You don't want to see excessive blanching. On the screen I have about as much blanching as you want to see. You never want to see the tissues go white, for sure. So let's play the video. Alright, as you can see, I'm applying a little bit of topical anesthesia. And of course, the goal of all of us is always to give painless injections. The first thing is basically in the mucosa, carefully deposit some anesthetic, probably up to a quarter or to 1/3 of the carpule. This is articaine, so it's very fast acting. So as you can see, it's bubbling a little bit. At this point, I'm not touching the bone. I'm just on the mucosa. I may choose to put a little bit more Usually this whole process is going to take me about 30 seconds. I'm at this now I'm actually touching the bone. And you actually can see a little bit of blanching happening on this second portion. Um, I will deposit up to a third of the carpio on this technique. By the way, I just want to mention that this technique works for every situation. I really never ever block anybody. I even place implants with this technique, even extract teeth with this technique, and certainly any restorative procedure. Now you see that I went into the mesial papilla of this first molar, and you can see the blanching happening. Again, we don't want to over blanch. Now I'm doing the distal papilla, and I'm going to go through the papilla until I touch the bone. It looks a little awkward because I'm trying to not cover the camera. But basically I go through the papilla to the bone and deposit my anesthetic. And you should see blanching, but not excessive. I don't want the tissue to look white. Then sometimes, I give a little bit of time until just a few seconds until that blanchness goes away. And then I go back in and deposit a little bit more. My intention is by the time I'm done, I'm pretty much going to deposit the entire carpio between all three areas. And usually 2 minutes later, we're done. Finally, an important thing, protect your hands. Don't use this technique just with a regular syringe, because you have to apply a lot of force in many situations, and I don't want you develop carpal tunnel or something like that. So using a mechanized syringe is a very smart idea. Something like a Lego-Jet or something like that will help minimize the force that you need to use on your thumb. When you have a technique like that is predictable, that is fast, that is painless, every time you have to cement a restoration, you will not, think twice of getting your patient numb, so you can, do whatever is necessary to give the patient the best, absolutely best results. It's been a great pleasure sharing this technique with you. I hope this technique will be of great value to you. It has been for me for the past 15 years. If you have any questions, please visit our website, Ruiz Dental Seminars, and there's lots of valuable information there for you. Have a wonderful day.